Hey, what is up guys? Welcome back to the channel. Today we're going to talk about the 5 reasons you're having a toothache. So every day I see patients that are having aching teeth or teeth that really hurt, and today I'm going to talk about the 5 main reasons why you could be having this type of pain. And if I start sweating in the video, it's because it's about 109 degrees in San Diego today. It's crazy hot, so if you see beads of sweat, that's why. Okay, so we have to get this out of the way, but the number one reason you're probably having a toothache is because you have a cavity. A cavity is essentially a hole in your tooth that is caused by acid-producing bacteria that eats away at your tooth, and if a cavity gets large enough and approaches the nerve, which is in the middle of the tooth, you can have severe pain. Now, not all cavities are large enough to cause this pain. A lot of times it goes silent or untreated, and then eventually, when you get to the point where you're having pain, it's so large that it might need a root canal or it might need to be extracted. So that's why it's so important to go to your dentist to diagnose your conditions, periodically. Ideally get your exam done every year to make sure that these silent cavities aren't going unnoticed. So what do dentists do to treat this type of cavity? Well, if the cavity is small, you can do a small filling with composite resin or that white filling material that's bonded to your tooth, and that can basically get you back to health. If the cavity is larger and it takes up a lot of your tooth, and it's basically a lot of your tooth is compromised, then sometimes you need a crown to cover up the tooth after you remove the entire cavity. If the cavity is so large and it's to the nerve and it causes that type of pain, that spontaneous, sharp shooting pain that wakes you up at night, that I wouldn't wish on my worst enemy, then you might have to get a procedure called a root canal, where they basically get rid of the nerve and then they put a biocompatible material into the tooth, and then your tooth will feel a lot better. I know there are some people that don't believe in root canals. Another option, if you don't want a root canal, is to get the tooth extracted. So those are your options. Now, dentistry has evolved so much in the past decade that if you are missing a tooth, there are replacement options. Some people can get like a partial denture. The best thing that you can do is to place an implant in the tooth. You go to the oral surgeon or some general dentist, place these implants, and then you get an implant supported crown that goes on top of that implant, and that's the best replacement option for you. Sorry for the audio. I think one of our air condition generator things just went off, so you're going to hear that a little humming in the background. Sorry about that. So the main thing that I just want to mention is that cavities do cause pain, but when they cause pain, it's usually a really large cavity. So be sure to go to your dentist and get that checked out, and there are solutions for you to start feeling better. The second reason that you might be having pain is that your bite is off. So let's say you just had a new restoration done, whether it be a new crown or a new filling, and it's still hurting you. And sometimes these new restorations can still give you pain afterwards. And usually what the problem is that when you bite down, you're biting high on the filling or the crown, and you're placing all that force from your bite onto that one part of the tooth instead of it being evenly distributed across your teeth. As dentists, we like to adjust the bite after we're done completing our treatment, but typically our patients are still numbed up, so we're basing our bite adjustment off of a numbed up patient, and it isn't really the most accurate thing to do. After the anesthesia wears off, you may be biting and it may feel like the restoration is a little bit high. Make sure to call your dentist because that can be really painful. Also, over the course of your life, your teeth are going to be shifting, and sometimes if a tooth shifts a certain way, you can put all that force from your bite onto one single tooth, which can be traumatizing to that tooth and cause tooth-related pain. One of the easiest fixes to do is to adjust the bite so that when you bite down, everything feels stable on both sides of the mouth. So the way we adjust the bite at the dental office is to take a carbon fiber paper. It's called a blue articulation paper. We put it on your teeth, you bite down, you grind left and right like you're chewing gum, front and back, and then we see marks on the teeth, and then we adjust those marks if they are too prominent. We want a light, even distribution of marks on both sides of the mouth so that you're not in any pain. The third reason that you might be having a toothache is from very sore gums. Now, you can get sore gums in a variety of ways. Sometimes you can be eating on hard food items, and a food item can get dislodged under the gum, and that can be really painful, and it can feel like the tooth has a cavity or the tooth needs to be pulled out. It can really, really hurt when all you need to do is remove that little piece of tooth under the gum. Also, if your teeth have little tiny gaps between them, little tiny spaces between them, food is very easily trapped into those spaces. This can be very annoying for patients that really want to keep their teeth clean. They feel like every time they're eating, they have to floss out food that's getting stuck in between their teeth. One of the best things to have is teeth that have contacts with one another, because if your teeth are not touching one another, then food can get trapped in there. It's more easy for you to get a cavity. We don't like very small spaces. Now, if a space is large enough, the food can pass through that space relatively easily, and it's not as annoying. You're not as likely to get a cavity, but that's why we want teeth that have contacts with one another. Sometimes if there's an old restoration on a tooth, like an old crown, and that tooth has shifted, then we like to take off that old crown and put a new crown that has a larger diameter so that you can have a flossing contact, which will prevent any food from getting trapped in there. Finally, you can also have sore gums if you have severe periodontal disease or gum disease, where your gums are swollen and puffy, where when you're brushing your teeth you're bleeding, or when you're flossing you're bleeding. So you have to get a really good cleaning to rule out whether this is causing you your dental pain or your tooth pain, because sore gums or swollen gums can be really painful as well. So what do the dentists do if you're having sore gums or if you have food dislodged under your gums? Well, typically if a patient comes to me and they're saying, oh, I feel like I ate something yesterday and it's really hurting under my gums, I'll take a look. We have some special instruments that can clean under the gums. If you're really swollen and it really hurts to touch the gums, then we might have to give you a little anesthesia. That's that needle and just a little bit of medicine. We go really slowly when we do it, and then we go under the gums and we clean the surface of the tooth to make sure there's no debris stuck on the tooth or any debris under the gums. And if there is something under there and you remove it, you'd be surprised how much relief you will have immediately after the anesthesia wears off or when you get home. So that is another main reason why you might be having tooth pain. The fourth common reason to have tooth pain is cracked teeth. This is the absolute worst thing to have. We see a lot of cracked teeth on older fillings. Let's say you have an amalgam or silver filling that encompasses a lot of your tooth that maybe you had when you were younger, and then you see crack lines propagating from where the silver filling reaches your natural tooth. Sometimes people don't have any pain on them, and then all of a sudden they eat something hard and the tooth breaks to a point where you have to take it out. Sometimes my patients actually do notice pain on a cracked tooth, but if they're noticing pain, that means the crack is probably pretty deep. The crack can be removed on the outermost surface of the tooth, your enamel, and maintained with dentin, or if you can remove the crack entirely, then you have a long-term success for that tooth. But a lot of patients don't realize how important it is to remove these cracks before the teeth break. So what does the dentist do with cracked teeth? Well, if the crack is small, we remove the entirety of the crack and we do a small filling to restore the tooth. If the crack is very large, we have to remove all of the crack as much as we can, and sometimes we have to remove any restoration that's associated with that crack, and we do a crown. If the crack goes all the way down, under the gums, we have to extract the tooth, and so on and so forth. So just be careful with those cracks, listen to what your dentist is telling you. And the final reason you might be having tooth pain is associated with your wisdom teeth. A lot of people get their wisdom teeth taken out when they're 16 or 17 or so. When your wisdom teeth come out, sometimes they come straight up and down, meaning you have enough room in your mouth and they are functional and they are available to you. Actually, having your wisdom teeth increases what we call your mastication efficiency, how you chew food. But a lot of times the wisdom teeth are hidden under the bone, or they are coming sideways where they're impacting, we call it a horizontally impacted wisdom tooth, where they're impacting the tooth next to it. And this can cause a lot of problems in the future. Typically, when a patient comes to me with wisdom tooth pain, they're mentioning that they're having some soreness on their jaw towards the back. Typically, it's generalized, meaning it's on both sides, or saying it's on the left and the right side. And usually we take a periapical image. We can see that the wisdom tooth is maybe rotated, or maybe it's just causing some discomfort or pain, and then I'll refer them out to an oral surgeon who has special tools to take it out. So what does the dentist do when you're having wisdom tooth pain? Like I said earlier, you have to get the wisdom teeth taken out. Some dentists will do the wisdom teeth extractions there. Some dentists will refer it out to an oral surgeon to do it. You're going to have different options options. You can go under IV sedation, basically getting knocked out in order to take the wisdom teeth. That's recommended if you're getting all 4 of them taken out, because typically the surgeon has to remove a little bit of bone over the tooth. Sometimes the tooth comes out in multiple pieces, and this isn't really something that maybe you want to hear or be awake for. So if you are going to get your wisdom teeth taken out, at the minimum, I would recommend laughing gas or nitrous oxide, but IV sedation is really helpful for those anxious patients or for patients that really don't want to be alert during the whole wisdom tooth removal. Okay, so those are the 5 main reasons why you're having tooth pain or you're having a toothache, but I want to mention some other special considerations. Whitening in general can cause a lot of pain, and I'm talking about whitening toothpaste, and I'm also talking about the whitening gel. So whitening toothpaste has abrasive-like particles in it, and the abrasive-like particles help when you're brushing your teeth remove external stain that is found on the outermost surface of your tooth from tea, coffee, red wine, blueberries, blackberries, things with pigments in it, dark colored beverages. This can cause that type of stain, and when you use whitening toothpaste, it can remove that external stain and your teeth can be whiter. However, if you use it too much and you're using it every day, morning and night, because it has those abrasive-like particles, it can wear away the outermost layer of your teeth with time, a lot of time, and that protective enamel on the outermost layer of the tooth can be worn down, expose the second layer of your tooth, your porous dentin, and that can cause some sensitivity. So I have that problem, and so I use Sensodyne Rapid Relief. That's the Sensodyne I like. I don't have any relationship with the company, but that's what I recommend to my patients because it works for me. Sensodyne does also have a whitening product that's sold at Costco. I hate it. I don't recommend it. And there's another product that they have that really doesn't work for me. There's different active ingredients in all of them, but the one that works for me is Sensodyne Rapid Relief, so I'd recommend that for people that have generally sensitive teeth. Whitening gels, and I'm talking about carbamide peroxide, hydrogen peroxide from the whitening strips that is found in Crest White strips, or from the in-office whitening that dentists do, can be really painful as well. If your teeth are already sensitive, then I would be a little bit cautious about getting tooth whitening done. I would definitely go on a regimen of that desensitizing toothpaste I talked about earlier, the Sensodyne Rapid Relief, for 2 weeks prior to starting any whitening, because if you use too strong of a solution, like 40% hydrogen peroxide, it can be really painful. There are some people that undergo whitening where it takes a long time for them to feel like their teeth are not so sensitive when they're drinking cold beverages or if they're drinking anything too hot or too cold. So just be a little bit careful with using whitening products. Now, I do use whitening gel and it helps me brighten my smile, but I'm also using that desensitizing toothpaste to protect my teeth. Okay, so another special consideration can be if your teeth are worn down. Remember that our diet plays a huge factor in the health of our teeth. Some people will eat lemons every morning where that acid on the lemon will wear out the palatal surface or the back part of the teeth. Or if you have gastroesophageal reflux disease, where you have an acidic oral environment, that can wear down your teeth too. And when your teeth are worn down, they can become sensitive. Well, I really hope that was helpful, guys. I really never know what to talk about on this channel. I'm always thinking about what would be the most useful piece of content to deliver or share with you guys. I'm trying to grow this channel into something special. So thank you so much for taking the time to watch it, and I will see you for the next one. Thanks.